My name is Philip Audundahi. I'm from Ramatown, our local government, Borno State. Together with me is a friend, Dr. Amos Bokar. I've been battling with heart issue. It has taken up to 5 years. Finally, I was recommended to come here for surgical intervention.
My name is Dr. Benjamin Anyanwu. I am the Executive Medical Director of Regions Stroke and Neuroscience Hospital, Regions Healthcare. I'm a physician by training with subspecialty training in neurology, neurological and neurosurgical critical care, and vascular neurology. I did my neurology residency in JFK Medical Center, Seton Hall University in New Jersey, and then my fellowships in vascular neurology at Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. You know, it's one thing to say I want to help change the paradigm of healthcare in a third world country with its resources very limited. After having spent several decades in a country like United States and had reached the peak of your career. So that makes it a little bit difficult. The easier one is to say my objective is to contribute to saving lives, transferring technology, training younger people, and looking for ways to impact on humanity.
Our epilepsy monitoring unit, okay, is the first and only in the whole of West Africa, okay? So we have people that have seizures, right, and different type of seizures that we admit in the epilepsy monitoring, where we do a video EEG for them, right? I'm part of that team, and it's been a story that everybody wants to be a part of, because you used to see people who have seizures that have no hope of getting better in Africa. But since working at Regions, we've been able to have a lot of patients that come into the unit. They're able to get a proper diagnosis of what's going on with the patient and get an excellent outcome. We have patients that have 3 years, 4 years seizure free, right? They've never had seizures within this number of years, right? And it's something that is really inspiring. And also we have patients that had a vagus nerve stimulator, right, implanted in South Africa and also in the US. But unfortunately, in the whole of West Africa, there's no place to interrogate those VNS, right? So you have those patients suffering because nobody can help them. So also at Regions, we have been able to help those people, right? Provide VNS interrogation with the help of our epileptologist. And sometimes when you look back at these things, right, you feel very good because you've been able to help a lot of people.
We basically started with 12 nurses. But now I'll tell you that our nurses, all registered nurses, either RN or RN with other subspecialties, or BNSC. We don't entertain auxiliary staff. So we started with 12. Now we have almost 50 of them. Yes, because here we don't allow patient relatives take care of the patients. The nurses do total care. We started with 3 medical officers, and now we have more than 16 medical officers, and we have a number of consultants. Because we have neurologists, we have about 4 neurologists, we have endocrinologists, we have pathologists, we have nephrologists, we have cardiologists, we have them. And then, you know, we even have neurosurgeons, general surgeons, and we started cardiac surgeries too. So these are the areas we have really grown. Like I said to you, we didn't have theater, but now we have a theater. We do neurosurgery, we do general surgery, we do even ENT, plastic surgery. I didn't remember to mention the plastic surgery. We have all these specialists here.
I also was very mindful of the adage that says you can't teach an old dog new tricks. So what I did was, if you look around, 98% of my staff are very young people. So I focused on hiring very young people. All my general managers are young, you understand what I'm saying? So I focused on hiring them and basically teaching them from the scratch. I got some of my partners from the United States, some of them are Caucasians who sacrificed, came here to teach basic nursing, basic medical intervention, and basic things that should have been learned in university that was never learned, you understand? And some tech work as well. So having those people grow with this program has been phenomenal. Problem is that all of them are all running away like crazy, and there's craziness around the so-called JAPA syndrome. Everybody's leaving, which is the brain strain problem.
One major thing I know, here at Region, they don't lose hope on any patient. Patients have come here with 1% chance of survival, and such patient has survived and is still living.
The surgery took place a week ago now, and even after 2 days in ICU, I was discharged to the main ward, and the third day I started coming for exercise in rehab. So it's a sort of very quick recovery compared to when I was operated elsewhere, and it took me 21 days to be in the ICU, and then about 2 months again in the ward. Now that the surgery has been done, all those symptoms I earlier mentioned, they are gone, and I feel much better than when I came in.
In terms of growth, we had some reasonable trajectory before the fortunes of Nigeria in general around security began, and then of course the brain drain. The brain drain has also affected us because what you see is that you bring a doctor who's trained in Nigeria, who has never had exposure to some of the high-tech equipments we have here and the high-tech healthcare delivery we have here. So you educate this person on what to do, and it's almost automatic that once you provide them with a reasonable knowledge, they're gone, because that looks very attractive in their CV, and Saudi Arabia and UK and wherever you have is very willing to, even Ghana, to recruit them and pay them more, and they're gone. We have a program we call a Purple Clinic every Thursday here. In the Purple Clinic, we provide treatment to epilepsy patients from anywhere across the country for free. Their clinical consultation is free, and we work with 2 North America-based foundations, West Atlantic Stroke and Epilepsy Foundation, which I am the president of, and then another foundation called the ROW Foundation that generously donate drugs to us. They donate epilepsy drugs, we bring them here, we offer care, we do these things, you understand what I'm saying? So to me, that's growth, and we get patients from all the way from Benin, Lagos, sometimes coming here to obtain that comprehensive epilepsy service, from us. So being able to save people from undergoing the same fate that my father and my sister went through keeps me going. You understand what I'm saying? Being able to improve and train a lot of these people, young people, you understand what I'm saying? And give them hope to stay here, or hope or better education when they migrate to be able to have a better footing keeps me going. You understand what I'm saying? Being able to create programs, more programs that saves more lives keeps me going. You understand what I'm saying? And the general fact that I think that Nigeria, we're not done with Nigeria yet. Things will get better. Most of these countries Western countries had their rough times as well. And it will only take people like us to change the paradigm here, to change the narrative, you understand? You will never wait for an American to come here and change Nigeria for us. It will be me and you that will change Nigeria. So that keeps me going as well.